everyone, welcome to Medicine for the Soul. I'm Sarah, and this is your prenatal modifications video. This is going to be more informative and educational rather than a full flowy practice. So you will need props, a couple of blocks or anything like a block, a bolster, cushion, or a couple of firm pillows, and a blanket. This is going to be great for anyone that has a regular yoga practice and is pregnant and they want to continue going to those regular yoga classes, or someone who's pregnant that just wants to try a new regular yoga class once in a while. You'll learn modifications here that will help you to be more confident going into those practices and knowing what to do during certain points in the class. So let's get started in a meditation, a beginning of the class meditation. If your class starts on your back, a great alternative is to take your blocks, one on the medium setting or medium height and one on the tall height, and using your bolster or cushion to prop up, and you can lay back like that. This isn't necessarily a modification you need to do in the first trimester, but as your belly gets bigger, you want to avoid putting pressure on that vena cava, that major vein that can get compressed by too much weight from your belly and placenta, not allowing enough blood flow. So this is a great alternative for beginning of the class and also Shavasana. And anytime you're in these poses, these moments of meditation in your practice, place one hand to your heart and one hand to your belly and send a nice loving message to your baby, creating that connection and that bond while they're still on the inside. Deep breathing through your nose and out through your nose is great. In through the nose, out through the mouth is great. You can also do alternate nostril breathing. Any other really intense breathing exercises you're going to want to avoid during pregnancy. You can place your hands onto the mat and push yourself up. A lot of these modifications you might not need early on in pregnancy, but for myself, when I was pregnant, I found it easier to just modify right away so that I didn't have another thing I had to get used to as my body was changing. You can set your bolster aside. You can set your blocks up at the top of your mat. When you're doing yoga, when you're pregnant, you want to have a longer warm-up. So if you know your class isn't going to have an extended warm-up, maybe you want to do some stretching beforehand. Let's have a seat in a comfortable seated position for you, sitting nice and tall. And let's come into some seated circles. This is great to do whether you're pregnant or not, but it does warm up the hips and lower back. Your circle might be a little smaller if your belly is bigger. And switch direction. And come back up to an upright position. Let's come into a child's pose. Now, if this is one of those poses that most affected by, a bigger belly, so in the second and third trimester, those later weeks and months, you can still do it. You're just going to take a wider stance. So bring your knees nice and wide and you can come down onto your forearms, or, if you can, bring your forehead to the mat. If your belly doesn't allow for this, or if it's not comfortable for you for some reason, you can place blocks underneath your forearms and you can still push your seat back towards your heels. You're still getting that nice lower back stretch. You're getting that opening of the hips. Maybe send your breath down to your hips or your lower back, filling the space between your shoulders, so avoiding sinking down. And you can come back up, placing your blocks at the top of your mat and grabbing your blanket. You'll want to place a blanket underneath your knees. You might find that your joints are a little more sensitive, your knees are a little more sensitive during pregnancy. So coming into cat-cow, you can still do cat-cow, just a little tiny modification during your cow. So normally this is what our cow looks like. So during pregnancy, we want to think of a cow as just beaming your chest forward and looking forward with just a slight drop in the belly. And exhale into your cat, pushing the mat away from you. Think of it as giving your baby a nice squeeze. Inhale, beaming your chest forward, getting that nice upper back extension. And exhale, hug your baby. Let's do one more. Inhale. And exhale. You can remove your blanket. Let's inhale, tuck the toes. Exhale, push back into downward facing dog. This is an inversion that you can still do during pregnancy. Normally you'd want to avoid, or you do want to avoid any sort of inversion while pregnant, unless it's been a part of your practice for a long time, like headstands, and you clear it with your doctor. But downward facing dog is a great inversion that you can still work into your practice. You can pedal your feet out here. And look forward. Inhale, exhale, step forward. In your forward folds, you're going to find you want to just have a little bit of a wider stance. Maybe keep your knees soft, creating space for baby. And inhale, rise up into Tadasana. And while we're here, let's just see what a flow would look like if we have a big belly while we're pregnant. So inhale, arms up. Exhale, forward fold with some wide feet, soft knees. Inhale, halfway lift. Exhale, hands to the mat, step back. And instead of lowering down, you can stay in a plank and then just push back to downward facing dog. And inhale again, look forward. Exhale, step forward. Now keeping your feet nice and wide, making room for baby. We're gonna come into a chair pose. Inhale, arms up, exhale, relax into chair pose. So if you're in a class and a revolved chair pose, twisting is part of the practice, which we wanna avoid closed twists while we're pregnant. So an alternative is you can let's take our right forearm to our right thigh and just reach up with our left arm, gaze towards your hand. This is a nice open twist right here. You're still getting that movement, but you're not crunching or twisting too much here. And coming back into chair pose. The other alternative is to just stay in chair pose, stay in the traditional pose. Let's try with our left side, left forearm to your left thigh, and reach up with your right arm, gazing up. And coming back into chair pose, inhale, exhale, forward fold. Let's step back into downward facing dog again. Take one more breath here. And exhale, bring your knees to the mat. You can grab your blanket again. I guess we did need it again. So anytime you're coming onto your stomach during a class, if it's for Sphinx pose, bow pose, anything like that, you can come onto your knees and you can come into camel pose. You can come into camel pose with blocks. If that's accessible for you. What I like to do was to just lean back onto my heels and just kind of do a modified camel pose. Nice deep breaths, beaming my chest towards the ceiling. You'll want to look out for in pregnancy, and you can come forward again. Place your blocks off to the side. You'll want to look out for, in your practice, feeling hyper flexible. So if you're finding that you're feeling really flexible, that you can go further than you normally could, you want to back off a little bit and do about 80% of what your body is allowing you to do. You release a hormone in pregnancy called relaxin, and it actually makes you feel more flexible. So to avoid injury, you do want to just do 80% of where you feel like you can go. Another alternative for anything on your stomach, you can place your blanket off to the side. So another option for if you're doing something on your belly, or if you're doing something that is core focused, you can still do core work. I'll show you some options here. One option is bridge pose. So you can still do bridge pose, lifting your pelvis up, working on those core muscles, working on your glutes and legs. If this is uncomfortable, you can put a couple blocks underneath you, or you don't have to do anything at all. When you're in your class, you can always just chill if you want to. Another alternative is to do just a regular plank. If that doesn't feel comfortable for you with the weight dragging down, you can do an upward plank. So toes pointing up or out, whatever is comfortable for you, and making sure there's not too much weight on your belly, that you can still feel supported and lift your pelvis up. So those are two great alternatives. I'm going to show you just another couple of open twists that you can do instead of revolved twists. So if you're in like an Anjaneyasana and you're going to come into a twist, bringing your opposite elbow to your opposite knee, which we want to avoid, you can again bring your forearm to your thigh and reach up using an open twist. So thinking about open twist, that means my belly button is pointing out towards open space. If I'm in a closed twist, my belly button is pointing towards another body part. So we want to avoid that altogether. Options for back bends, again, using your props. You can use a block underneath a pillow or bolster and come to recline. This is a nice subtle back bend. And relax here, or you can take the block away. Other options for twisting or seated twists. So if maybe you're coming to the end of your class, or they're doing a seated twist at the beginning of your class, something that you can do is place your hands at the back of your head, your clasped hands, and sit nice and tall and just twist where you're doing an upper back and shoulders. So that's where it's all focused. So we're not twisting, like a deep twist, but we're still getting that movement where there's, you're pressing your head back into your clasped hands. Take a nice deep breath and exhale. Twist just your upper back. Very subtle. And coming back to center. and twisting again. Just your upper back. And coming back to center. Anytime you're in a seated position and your hips are uncomfortable, you can place blocks underneath. You can also come into a wide leg position. This is going to be obviously an alternative for if you're doing a seated forward bend and we can't get there because of our belly. So just bring your legs nice and wide, and you can sit up on a bolster or a blanket to elevate your hips. It might feel better or just more supported, and come forward. You can use your blocks for support if you'd like, whatever feels good for you. If you ever feel pain, obviously in any position, you'll want to just find something else or just take a child's pose. And lastly, options for Shavasana. So the same position we had at the beginning of class or beginning of the video, which is medium setting block and then the tall block with your bolster or pillow. Another option is to lay on your left side, folded blanket underneath your head, and bolster between your knees. So knees are slightly bent, and the reason we want to lay on our left side is again to make sure that we are getting enough blood flow. Right side isn't bad, it's just that the left side is better. And also if you have acid reflux during pregnancy, laying on your left side is going to help that. So just left is best, remember that. So this is another option for Shavasana. And you can come up to a seated position. Thank you for joining me. Congratulations. And I hope this video was informative for you to continue your regular yoga practice. See you soon.